Hey everybody, it's Dr. Seiler from Seiler Skin, and we're going to do a fun treatment on Jillian here. Jillian works with us. She looks great. She really hasn't had too much done. I haven't done anything on her. She's been working with us for about 5 months now. She's got, go ahead and take your mask down. She's got really good cheeks to begin with, but her concerns are seeing a little bit of folding around the nasolabial area. And I think a huge take home for both patients and practitioners who are watching this for training reasons is that most of the time, this is the symptom that the patient sees, which is a little bit of laxity in the lower mid-face and what we call the nasolabial folds or jowls. And in her, she needs a little bit of volume replacement here, but where it's really coming from is in her cheek here. So she's got a really good, what we call anteromedial cheek here, but she's lost a little bit of volume and height in her cheek. And in examining her, you can see that with me barely just pulling up on her cheek here, this all really improves. So we're going to do a little bit of voluma filler in her cheeks and a little bit of juvederm around her mouth. She's got great lip structure. We're not going to say her age, but you would never believe that she's her age because she looks so young, and she's really taking great care of her skin. She's been in the business for over 20 years now,
yes.
Right?
Yeah.
So she's had the opportunity to take great care of her skin. So we really don't need to do a lot in her. We're going to do a little bit of juvederm around the mouth, and since her lips are pretty good and she's happy with them, we're going to do a little bit of juvederm in the corners of the mouth. So for patients watching, you can see a nice lift with a little bit of filler if it's done correctly. For those of you that are watching, for training purposes, I think the big take home here is that, in my opinion, it would be under treating the patient to simply just, put some filler around the mouth. Again, where the symptom is that the patient sees, and a little bit of the cause is coming from some volume loss around the mouth, but more of it is coming from the height of her cheek. We also do Botox in her, and so another thing that I think is very commonly missed by injectors is that they only look at the upper facial areas as areas where we inject Botox for movement lines. And in the majority of my patients, I inject Botox also in the lower face. This is the whole philosophy that I've developed over the years called Gravity Fix that you can see on our website. And what happens is with time, these muscles really get strong in the neck and in what we call the DAO muscle, and really pulls down on the lower face. And so it's not just about volume loss, it's also about those muscles pulling. So see if you can frown a little bit for me. You see how she really fires this muscle here, and then flex your neck for me, and she really fires that muscle. So all of those muscles on a daily basis will pull down on the face. So you would unfortunately be kind of under-treating her by not also using a neurotoxin to help release the muscle. So we're going to do a little bit of all this in the next couple of stages, and hope you enjoy it. So we've already done her upper face Botox, pretty easy areas. You've seen that in our other videos, so we decided not to film that for time's sake. We've done her forehead, between her eyes, her crow's feet, and her bunny lines, the upper 4 areas. So now we're going to do what we call the Botox Lip Flip. This is part of our Gravity Fix philosophy to help with muscle movement around the mouth. Again, this is something that's more unique to our practice that not a lot of people do. So push your lips for me. And you can see that, so this is going to do 2 things, all right? Relax. This is a tiny little pinch. We iced before. Everybody's always nervous about this shot, and it pinches a little bit, but it's quick and over. What this will do is this will help to keep her from making vertical lip lines, but it will also help to kind of give her a little bit better show to her lip. It's not going to do as much as what filler would do, but it will release that muscle so that she kind of naturally shows the volume of her lip without putting filler in. And then frown again for me. All right, relax. So you can see that this muscle fires really good right there, and is what pulls down on the corners of the mouth. So this is a really interesting injection. It doesn't take a lot of Botox. We usually only put about 5 units over these 2 shots on both sides, and about 5 units in the lip, so it doesn't take a lot of Botox. And that again will release the muscle that pulls down on the corner of the mouth, so that when we do put some filler in there, we'll get a better lift. All right, and then flex your neck for me. And you can see she really fires her neck. So what we do here is we grab what we call the Platysmal Band, which is the little bands in the superficial neck muscle, and we do about an injection every inch or so, and that will really help to shut that muscle down. Usually the patient has a good lateral band and a pretty good medial band, and so you just do a different amount of Botox in each patient. I usually put about 5 to 8 units per band. All right, do it again for me. You can see that she pulls this one pretty good. So if you miss this, you're not going to get near as good of a lift even if you put the right amount of filler in, because those muscles will still be pulling down on the lower face, kind of like the strings in a parachute are kind of pulling down on the lower jawline. All right, we're going to switch to the other side real quick. I'm going to go ahead and do the DAO if you want to do her icing. And you can see on this side, she pulls even harder. Do it again for me. It's really obvious right there and in her neck. And this little injection will really help to release that muscle. And really the only ones that are a little uncomfortable with the lip, but they're quick and over with, so it's not that big of a deal. Jillian has even told me she's a little bit of a weenie when it comes to injections, but she's tolerating this great. If I do that little wiggle right there, that usually distracts the tissue, so they don't really feel it much. All right, fire your neck again for me. Her two bands are pretty prominent here, so we'll do this, and basically what I have to do is kind of grab them and get behind them. And this is actually really safe to do. You're not anywhere near the deeper muscles or the blood vessels. You're nowhere near anything that you can really harm if you do this correctly. All right, relax. And that's it for Botox. So we've completed her upper face Botox, or lower face. Sometimes in some people we need to also treat the chin. She doesn't really fire her chin muscle much, so we don't really have to do that in her. Some patients will have a pretty thick, what we call masseter, which is the chewing muscle that a lot of people have that have grinding or clenching issues. And so we can inject a little bit of Botox back there too, not only to reduce that strength, but also to shape the jaw a little bit if we need to. Hers is not real prominent, and she's got a nice jawline, so we're going to leave that alone in her. All right, we're going to pause for a second, and then we will continue on in a minute with our filler. All right, so we've completed all of our Botox areas in the previous little section, and now we're going to do a little bit of filler enhancement to the cheek. I'm using Juvederm Voluma here, which I think is the best filler for the cheeks. And she's really got good cheeks to begin with. I mean, if you look, she's got a pretty good angle, but she needs a little bit lift out here. She's got just a little bit of volume loss right there. We're going to use the best device ever invented, which all of y'all know anything about me. You know I'm a huge fan of the AccuVein. This is still something that unfortunately not a lot of people use, but they need to. All right, little stick here. It shows me where all the blood vessels are to help from me hitting them for bruising purposes, but also for damaging them. So this is a area where you've got to be really careful to inject so that you don't damage the deeper tissues. I always aspirate, make sure that I'm not in a little blood vessel. For those of y'all watching this for training purposes, make sure you always aspirate. And we'll do a little bump right there, and I'm doing a deep injection. And again, I'm not injecting as I move forward. I'm just injecting when I get deep after I've aspirated. And Voluma will thicken just a little bit. So once that thickens, that will pop up real nice. And then, yeah, come up a little bit more lateral. And she's really got a good anteromedial part of her cheek, so we really don't need to put any filler there. We want to put filler up higher on her cheek to get her lifted. All right, should be good. Let's take a look here. All right, good. So we don't see any little blood vessels right there. So what I do is I anchor the skin up like this, do a little wiggle. We've already iced her, and she doesn't have any numbing cream on. We numb patients sometimes if they want it, but most of the time people tolerate this really well with just a little bit of ice and me taking my time. You doing okay?
Yeah, you're very gentle. I can't barely feel it.
Good. And you've had filler before?
Yes.
And you think it hurt more than this?
Absolutely, yes. Yes, you're.
So this is the first time I've done any filler in Jillian. We did her Botox today for the second time. We did Botox on her a couple months back. And I'm not putting a lot in per injection. I mean, I'm putting about 1/10 of a cc in per injection here. And then I kind of mold a little bit. And you can pretty aggressively mold Voluma since it's so thick. All right, let's look again right straight there. All right, and I saw little bitty blood vessels, so I'm going to get away from that. And that really helps me just adjust my needle placement and my angle. Got a lot of little blood vessels deep to the skin that you really can't see, and so that really helps us keep from bruising. I will say that most of our patients do not have bruising at all, and very few of them will have even minorly significant bruising. We also offer a free IPL treatment the next day or two. If somebody does have a tiny little bruise, they can come in and get it zapped with the pulse light device, and that makes the bruise go away really quickly. All right, let's look up here again. I think she's still cold enough. Come a little bit straight around. There we go. Okay, good. So I'm just kind of working my way up into the cheek. We're also going to put a little bit in her temple. And this is just really recreating the angle of the cheek where she's flattened and squared off a little bit. This is a deep injection. And again, you can, if you're watching for training purposes, you'll see that I'm aspirating every time to make sure that I'm not in a blood vessel, to stay very safe. I'm putting just a little bit in each time. And we're going to use 1 syringe total of Voluma. I think a half a syringe on each side is going to be plenty. We can always come back in and add a little bit more if we need to, but I get really good results being very conservative with our filler. All right, let's ice the temple. Cindy's doing a great job of being out of position to assist me today, so usually she's on my side, but is that cold?
Yes.
Okay, good. I think the ice hurts more than the injections do, right? Okay,
yes,
good.
For sure. The injections
All right,
aren't hurting
perfect.
at all.
So in that little view right there, I saw a big blood vessel that was right where I wanted to inject, and so I was able to go just under it. So that avoids a huge potential bruising area right there by using that AccuVein. I'm going to do one more injection right here. You can see that I'm pretty deep, taking my time. Pop the temple up real nice. And then we're going to pause for just a second and do the other side. So we've really augmented the cheek here. Now you can see she's got a better angle, and once this really kind of thickens the tissue and gives her the final lift in about a month, she'll see a nice lift before we even do any filler around the mouth. All right, so we showed you the cheek with Voluma on the left side of her face. I went ahead and off camera did the right side, so we've already completed her cheek on this side. Now we're going to do Juvenorm on the side. We've already iced her. Let's do a little alcohol wipe real quick. And then we'll use our AccuVein to see if there's any little blood vessels. She's got them all over the place. She's got little blood vessels all over the place.
Sorry about that.
You're vascular. That's okay.
Sorry.
You're a little red tinged, but I do a little different technique than I think most people do. A lot of people will fan and go back and forth. I think you cause more bleeding that way, and so just kind of like I do with my Voluma injections, I generally go deep with this. I aspirate to make sure I'm not in a blood vessel, and then I come backwards, and then I do a little bit of a fan, but not much. And then I can kind of spread that out a little bit with my finger when I mold. I think it's also really important, I didn't mention this earlier, and Cindy does it so good and so quickly that you don't even see it, but Cindy's got a alcohol pad wrapped around her pinky finger. So every time that she ices, she wipes the skin with alcohol. We've already cleaned the patient's face and alcoholed, so we've already prepped her ahead of doing all this, but I treat filler like it's an implant, and so we want to be as clean as possible. So even though our gauze is clean, our gloves are clean, we use regular ice, so we want to alcohol before each little stick. All right, so just kind of alcohol right there just for a second. If we've touched the patient with anything, show me again. You can see she's got just a tiny little spot of blood, but that won't turn into a bruise at all. Again, I'm aspirating. You may not even really see me aspirating because I do it so kind of calmly and quickly, but I'm trying to stay off camera here so you can see this. So I'm not putting too much in. I'm just putting a little bit in. We've lifted her cheek pretty nice already with the Voluma, so we don't have to put a lot of Juvenorm in around her mouth. A lot of people would put 2 or 3, 4 syringes just around her mouth. But she really doesn't need it. We're going to put half a syringe of Juvenorm on each side. We're going to put a little bit here in the second in the corners. Mold that in really nice. And Juvenorm also really expands, so you actually kind of underfill them a little bit. All right, let's ice down here in the corner. You actually underfill the patient just a little bit because you know the Juvenorm is going to really absorb water. It has a very high water affinity, so it thickens kind of like a sponge and thickens the tissue really nice. So you have to be patient on the result. I mean, you see a little bit of the result in the first week or two, but then they really see the max result at about a month, and then you usually get a good year out of it. So, all right, so this is a cool little injection right here that we're going to do. I do a little bit of a triangle injection. Show me again real quick. Okay, good. So I'm going to come right here at the corner, and basically what this does is this kind of lightly builds up the corner of the mouth, what we call the oral commissure. You go deep with this injection, and here usually you don't have much vascularity, so you can go back and forth just a little bit. This isn't hurting, is it?
No, not at all.
And again, she's not had any numbing cream, no nerve block or anything like that. I used to do that on everybody, but I just don't have to do it anymore.
No, it's amazing you're pain free. Barely feel anything.
Let's ice real quick again. And then this is a cool little shot that kind of goes on top of that shot I just did. I do this in pretty much everybody. This is not really a full lip augmentation, but we're going to do the edges of the vermilion border on the upper and the lower lip. And what I do is I hold this nice and taut here. I kind of pop the lip a little bit so she doesn't feel it, and I get to where I want to be. And you also notice that I kind of have my hands on her a little bit here, so she's distracted by multiple touch points. We do a little bit right there in the corner, and then let's look kind of under with the AccuVein. Let your mouth just kind of relax open. Okay, good. I'm going to do the same thing right here. And these really won't make her lips any bigger, but it'll just make the corner of her lip a little bit more curt, a little tighter, so that the corners look nice. And again, I'm just putting small amounts of filler in each one. Not a lot of injection, or not a lot of filler per injection. And again, once our Botox continues to kick in, Botox in the lower face usually takes a couple of visits to really relax the muscle. And what you'll see is a nice elevation of the mouth. The smile will look prettier. Once the neck muscles release, then they'll really start to give way. All right, let's ice one more time. I think this is another injection that is unfortunately commonly missed, which is it's about halfway kind of between a line of the corner of the mouth and the corner of the nose to the center of the chin. Usually you have a little bit of area right here where they see a little divot, a little bit of devoid of tissue right on the jawline. Tilt your chin up for me a little bit. And this is another injection that usually they don't feel too much if you do it correctly. This injection is going to go deep, and this will help to kind of shape the jawline a little bit and finish off the bottom of what we call the marionette line. And just kind of straighten that jaw a little bit. And it's subtle, but it's enough to make a nice little difference. So you can see we popped her out really nice here with really, I only used about 3/10 of a syringe up here and the rest of it around here. She's a little swollen right there, but once that goes down and this kind of pops up and the Botox kicks in, corner of her mouth will look really nice. And we did all this with a total of 2 syringes of filler. We'll probably come back in a month or two and evaluate her lips. We can always add another syringe if we want to do a little bit more in her lips, a little bit more around her mouth. So we always have that opportunity to do one more syringe if we need to. But we really did kind of a full face lift here with some Botox and filler, and we're going to finish off her other side and we're going to let her go. So thanks for watching.
Great.
All right, so we're all done with our treatment. Like I said, we did Botox in multiple areas around her, but very conservative. We used a syringe of volume in her cheeks and a syringe of juvenium around her mouth. But I think what's unique about this is really not only making sure you put the filler in the right places, but address the lower face with Botox to release the pull of the muscle. We were talking kind of when we were on a break about the fact that she smiles a lot harder on this side.
Yep.
So I did kind of overcorrect that a little bit, and once that fills in and lifts and everything, she should be pretty even. Once the Botox really continues to work over the next couple sessions, that will keep from pulling down. And you can see that, I injected all through her upper and lower face with Botox and all through her face with filler, and she's really got no evidence of bruising. She barely bled at all from it, so our AccuVein really changes the whole anti-bruising issue. And we lifted up her cheeks really nice here. And so this is the what I call the gravity fix philosophy, which we've developed over the years, using the 5 proportions of the face to understand where to put filler and how to get a lift, but also address areas of gravity with lifting, but also areas of movement with neurotoxin. So once this kicks in over the next couple of weeks, you'll see a nice result. And we didn't have to use a lot of product, and she'll be really happy with it. So.
And it didn't hurt at all. It really did not hurt at all.
And that's not because I'm paying her to say that.
No, he's not paying me at all. It really didn't. I've had this done a lot, and you are by far the gentlest person.
Thanks.
Doctor, I should say.
Appreciate that.
That's injected me. So
I think just taking your time, using a little bit of ice, the little wiggle that I do, I think that's all the difference between injecting really quickly and hurting the patient and just taking your time. And it really didn't take you very long.
No, it didn't. No, and I think taking your time, just the fact that you're a little bit slow, it just it's painless.
Good.
Yeah, it's good.
Perfect. Now she can go back to her normal day and not have to worry about any downtime. So thanks for watching. Check out our other videos on our website at Siler Skin. If you're interested in training, Siler Skin Aesthetic Institute is my training company, silerskinai.com, and you can check out all of our online courses there. Thanks for watching.